Hospitals will send thousands of patients home earlier in a desperate bid to free up beds. Thousands of patients will be discharged from hospital more quickly under an NHS drive to free up beds. Up to 18,000 hospital beds are currently occupied by long-stay patients, those who have been there for at least 3 weeks. Simon Stevens, the head of the NHS, has promised to reduce this number by a quarter by November to free up at least 4,000 beds. There are a little over 130,000 beds on the NHS in England, meaning nearly 1 in 8 are occupied by long-stay patients. The plans have been drawn up jointly by NHS England, which is responsible for the NHS's day-to-day running, and watchdog NHS Improvement. Hospitals will be urged to work closely with local councils to ensure care is ready for patients in their homes so they can be discharged more quickly. They have also been told to send many more patients home at the weekend, rather than forcing them to wait until Monday morning. Philip Hammond has vetoed plans for a dedicated NHS tax to fund a major increase in health spending. Whitehall sources said last night that the Chancellor had succeeded in killing off the idea of a ring-fenced 1p in the pound rise in national insurance. This was championed by Health Secretary Jeremy Hunt and would raise about £5 billion a year. The decision has left ministers casting around to find a way to pay for Theresa May's pledge to give the NHS a significant funding increase to mark its 70th anniversary, which is due to be announced this month. Mr. Hammond has also argued successfully against awarding the NHS a long-term rise worth 4% a year in real terms, following warnings it would lead to tax increases on families of up to £2,000 a year. Instead, debate is focusing on a real terms rise of about 3% a year, the equivalent of about £4 billion a year for the next few years, although Mr. Hammond is still pushing for a lower figure. One Whitehall insider said, 3% increases in real terms would be a lot of money. 4% equates to a very, very big number. The implications for the public finances would be pretty unpalatable. Discharge rates are typically much lower at weekends because there are fewer staff to fill out the paperwork and ensure patients go home safely. Doctors and nurses will be instructed to monitor closely the length of time patients stay in hospital. If patients are on a ward longer than expected, based on their age and condition, this must be flagged up as a safety issue and urgently addressed. Research has shown that patients over 80 lose 10 years of their life for every 10 days they spend in a hospital. They lose at least 10% of their muscle mass as a result of being immobile, which has a dramatic effect on their health. At the same time, GPs and social care services will be urged to try to prevent patients being admitted to hospital for avoidable reasons. A study last week found that a quarter of patients taken to hospital as emergency cases last year had entirely preventable conditions. The plans will be announced by Mr. Stevens in Manchester today at the conference of the NHS Confederation, the body for organisations that commission and provide NHS services. He said, "Over this past year hospitals and local councils have successfully worked together and have turned the corner on delays in patients being discharged. Now they need to go further in order to ensure patients are looked after in the right setting for them." Ian Dalton, chief executive of NHS Improvement, said, "No one wants patients to stay in hospital longer than they have to, or for the health of patients to deteriorate in the very place that is supposed to be making them better. But this is happening all too often and we have to work together to change it." NHS officials stressed that patients would not be discharged before they were ready to go home. Rachel Power, chief executive of the Patients Association, said, "Improved support to ensure patients can stay as well as possible in their own homes, whether immediately after an admission or as a way to prevent one, will be vital in ensuring the NHS meets the changing needs of our population."